Does a terminally ill person have right to hasten his death by withdrawing medical treatment or by administering lethal injection? Let's discuss the issue of passive euthanasia held in the landmark judgment Aruna Ramchandra Shanbaug versus the Union of India. Hello everyone, I am Divyanshi Maheshwari, currently studying in second year Institute of Law near my university. Also, I am doing my winter internship under Sejpal Associates. So let's discuss the issue. The case Aruna Ramchandra Shanbag versus the Union of India stood as a landmark judgment as it discussed the long-drawn issue of passive euthanasia and eventually supported the legalization of passive euthanasia. So first, let us understand what euthanasia is. So euthanasia is derived from a Greek word which means dying well or good death. It is quite a complex ethical issue. Also, it has four types. First is physician-assisted suicide. So it is suicide which is assisted by a doctor by specially providing medical means of suicide. For example, a prescription of an overdose. Next is active euthanasia. So in this case, the doctor directly intends and causes the patient's death. For example, by giving lethal injections. Third is passive euthanasia. It is in this case, life-sustaining treatment is either withheld or withdrawn from the patient. And last is non-voluntary euthanasia. So any kind of active or passive euthanasia done to an incompetent patient comes under non-voluntary euthanasia.
So now let us look onto the facts of the case and how a nurse ended up as a lifelong lifeless patient. So Aruna Shanbag was a nurse at King Edward Memorial Hospital, Mumbai, commonly known as KEM Hospital. And on the evening of 27th November 1973, when Aruna was changing her clothes in a room, a hospital sweeper assaulted her. He intended to rape her. He mobilized Aruna by twisting a dog chain around her neck. But when he discovered that she was menstruating, he sodomized her instead. Further, she was found nearly 12 hours later and that too very unconscious. So, Aruna suffered acute brain damage and because of lack of oxygen supply to her brain. And after that incident, she never recovered from the attack and ended up being a helpless patient for the rest of her life. So, when the matter reached the Supreme Court in order to analyze the administration of passive euthanasia to Aruna Shanbag, the Supreme Court set up a team of three doctors to objectively report to it on Aruna's physical and mental state. The court also allowed a video recording of Aruna's condition to be screened in the courtroom. The Supreme Court set up a High Court monitored mechanism to handle such type of cases. What the court essentially did in this case was to follow a method it thought most appropriate and establish that method as a benchmark for all high courts to deal with cases seeking approval for passive euthanasia. The model includes appointing a team of doctors which consists of a neurologist, a psychiatrist, and a physician to report to the court, issue notices to the state and close relatives of the patient, and so on. It would ultimately be up to court to determine if the case were fit for permitting passive euthanasia. After considering the doctor's report and the next friend's opinion, the team concluded that since Aruna was not in a position to take a decision, the appropriate person to do so would be the dean of the KEM hospital, since it was the hospital staff that had tended to her for 37 years. Let us look on to the legal issues that were dealt in this case. So, the first was that if a person is incapable to provide consent, should non voluntary passive euthanasia be bestowed upon that person? And the second issue was that whether suicide should be considered as a crime under Section 309 of IPC. While dealing with the first issue, that when a person is unable to give consent, So the court held that the consent of guardian or the next close friend should be administered. And while dealing with the second issue, that is, should suicide be considered as a crime under IPC? So the court held that while the right to life under Article 21 includes the right to die with dignity, but it does not include the right to die per se. So, in other words, suicide is illegal and punishable, but passive euthanasia is legal under certain circumstances. However, the court did recommend the deletion of Section 309 of IPC, that is, suicide as a crime, because it found it underscoring that a person who attempts suicide needs help rather than punishment. So, while dealing with the case, arguments from both the sides came across. There were people who supported the legalization of euthanasia and also the oppositions. So, the supporters believed that patients and families should not be forced to suffer through a long and painful death, even if the only way to alleviate the suffering is through suicide. Further, it becomes ethical and justified when the quality of life of the terminally ill patient becomes so low that death remains the only justifiable mean to relieve suffering. Also, in reference to this case, the position of euthanasia in India today is that while the law recognizes euthanasia in cases of physical suffering, no amount of mental suffering would justify a claim to end a person's life. So, if a person is in depression, he cannot be administered passive euthanasia. But if he's suffering some physical suffering, then it is recognized under law. Though many people supported legalization of euthanasia, but some opposed to this, and the opposition came from numerous different perspectives. So, from a mental health perspective, professional, psychiatric, and psychological training reinforces that the view that suicide should be prevented at all cost. Here, since euthanasia is also a kind of physician assisted suicide. Secondly, family members would suggest that death is inevitable and it should be preferable if it occurred sooner because of social and financial burdens involved in caring for terminally ill family members. Further, many factors, including the commercialization of healthcare, the allocation of medical resources, should be taken into account to frame policy on subject. The Honorable Division Bench of the Supreme Court of India delivered the judgment on 7th March 2011. The court declared that Aruna was not brain dead, and for its judgment, it relied on the doctor's report and definition of brain death. As she was able to breathe on her own, without a machine's support, she had feelings and used to show some symptoms. Her condition was quite stable, so the grounds presented there were not sufficient for her for terminating her life, as it would be unjustifiable. Also, the right to take any decision on behalf of Aruna was vested in KEM Hospital. So, in the present case, it was the food on which she was surviving, and thus, removal of life saving technique would here mean depriving her of food, which is not justified in Indian law. Further, the verdict of this case has helped in clarifying the issues relating to passive euthanasia in India by providing a broad structure of guidelines that are to be followed. So, in order to conclude all of this case, the medical science is progressing in India as in the rest of the world, and hence currently we are having devices that can prolong life by artificial means. The proponents and opponents of euthanasia and physician assisted suicide are as active in India as in the rest of the world. However, the Indian legislature does not seem to be sensitive to these. Further, the landmark Supreme Court judgment has provided a major boost to the pro euthanasia activists, though it is a long way to go before it becomes a law in the parliament. Moreover, concerns for its misuse remains a major issue that ought to be addressed before it becomes a law in our country.